Welcome to Season 2 of Unprivate Parts. This podcast is a space where women can feel supported and understood as we have open, honest conversations about women's health and the uncomfortable subjects we all want answers to. In this season, we will explore the complex realities of breast and gynecologic cancer journeys, breaking them down with empathy and expertise. From hearing the words, "you have cancer," to making decisions, undergoing treatments, navigating survivorship, and seeking support, we will cover it all. Nothing is off limits, and no topic is too uncomfortable to discuss here. This is Unprivate Parts.
Hi, welcome back. I'm Lauren Smith, the Manager of Business Development here at Women's Hospital and the host of the Unprivate Parts podcast. If you've ever stood in your bedroom staring at a bag wondering, what on earth do I bring to chemo? Then this episode is for you. Today, we're joined by Ms. Ashley Marks, a Women's Hospital Oncology Nurse Navigator, to break down exactly what to pack for chemotherapy and infusion appointments, the essentials, comfort items, and entertainment. Because when so much feels uncertain, being prepared can help ease your anxiety and make the treatment days a little more manageable. Welcome, Ashley.
Hi, thank you for having me.
Thank you for coming. Let's just jump right into it. What is an oncology nurse navigator?
An oncology nurse navigator is someone that is certified in the care of cancer patients. Basically, your private personal concierge roadmap. Our jobs are to help you understand your diagnosis, understand the treatments, the side effects of those treatments, refer you to the appropriate resources. We have a big team. We have, like I said, the social workers, dietitians, chaplains. We have palliative care nurse navigators that work on symptom management, a survivorship navigator. We have all these resources, and we want you to get to the most appropriate support person. And that's our job, to know where you're at, making sure we get you to those appropriate resources, and also ensuring that emotionally you're doing well, that you're understanding what you're actually going through.
For someone about to start chemotherapy, the first infusion appointment can probably feel overwhelming. From your experience, what are the patients most anxious about when they come in?
The unknown. When you come into infusion, there's a room full of people. You don't really know the order of the medications. You hear things about side effects, and it's scary. Most of them are not actuality. And so I think it's mostly the unknown, just not knowing what tomorrow is going to bring after I get all these medications.
If you were to talk to a newly diagnosed patient first time, what to bring to infusion?
I think the first thing I would make sure that I brought is someone that comforts me. You can bring one person with you to the infusion center, and you're very overwhelmed. So you're not going to hear a tenth of what instructions are given to you by the nurses. So I would bring somebody that is able to listen to the education that also calms you when you get anxious.
Tell us about the support person when you're going to your infusion appointment. Are there any limitations? Can you bring your kids?
As far as support people go, children are not allowed in the physician's offices or infusion centers, so they have to be at least 16 or older.
What's their policy on service animals?
Women's Hospital does have a service animal policy and procedure. And so if there's someone that does have a certified support animal, you would talk to your navigator, and we would make sure that we get the appropriate permission to bring that animal to the facility with you.
How long do the infusion appointments typically last?
It really depends on the regimen. They can last from 30 minutes to 6 hours.
And so what to expect once you arrive, you have your support person. Do you check in with a navigator, or who do you check in with first?
So you will check in with the infusion staff. You usually get lab work, and then most people see their physician prior to getting an infusion. And then as you're led back to the infusion suite, each person has their own little bay. And so there is a recliner for the patient that is a heated chair, and there's a visitor's chair, as well as a television. and each television is hardwired so that they do require earphones, which we do have for the patient and the visitor. So you think it might be really loud in there just from TVs and people, but we really try to keep the stimulation to a minimum.
And I don't have any experience with this, but I've always heard it's very cold, and I see patients bringing blankets. Can you bring personal items?
You can definitely bring your personal items. We do have a blanket warmer in the infusion suite. We have pillows, and the chairs do warm up themselves. Some people do bring like prayer blankets or their comfortable blanket and pillow, just whatever they need as an item to make them feel more at home in the infusion suite.
What about any favorite scents or diffusers? Is that allowed?
No, definitely not. Just because it can be offensive to other people just because of their sensitivity. So we do ask that no one, including visitors, wear perfumes or, heavy laundry scents. But we do provide, if someone asks, or you can purchase aromatherapy that is in a little personal diffuser that doesn't permeate the whole infusion center, but you just inhale it. It is definitely helpful for anxiety, headaches, prevention of nausea.
Oh, like the little pens.
The pen, exactly.
Okay. Okay.
Soothing scents is what we use.
Infusion can take a lot of time, involve a lot of waiting. What are some great ways patients can pass the time?
So besides television, people will bring iPads to watch movies on. Again, we do ask that you do have earphones just for the other people in the infusion center. Some people play cards, color, music therapy within their iPhones, and networking. It's really good to network with the other people in the infusion center. You find out a lot about ways to manage side effects. Even though we do our best, I've not gone through this treatment before. So people that have gone through the therapy, they actually have some really good support answers and tips for you. So networking is good too.
And some of these important things, I imagine, can't be packed in a bag like your support person. But how can bringing your friend and family member help on infusion days? Other than, do you get sleepy when you receive treatment? Is it mainly for them to remember what you're distracted about?
Some therapies do require some pre-medications that will make you sleepy. Others do not. And sometimes it's just having that person there just to chat with. It doesn't have to be like people that have been through therapy, they know what to expect, but they just want somebody to talk to pass the time. And so they'll bring somebody with them for that purpose.
Sometimes I've heard patients say they wake up, they're too exhausted to go to their infusion appointments, but then after coming to Woman's, they feel better than when they came in. What do you think that's attributed to?
I do think that the attitude of their team members plays a big part of going to infusion and walking out thinking things are not quite as bad as you think it would be when you go to infusion. The infusion suite is full of windows. It has great views. The sun can shine in. And the staff, the nurses that work in infusion are just happy. They're welcoming, they're calming. And then, of course, the support staff that we have, which includes not only nurse navigators, but we have the dietitian, we have the social workers, we have chaplains that are dedicated to our oncology unit, and we also have our massage therapists that several days a week, they come in and they do hand and feet massages for the patients.
Are you allowed to have snacks, or do you feel a certain way when you're having your treatment administered?
Most of the time, you do not feel anything as you're getting the treatments. Now, you may be a little tired if you have certain pre-medications. Nausea is, fortunately, with the new medications that we've had developed in the last few years, we really can control nausea for the most part throughout the treatment. So you do not feel nauseated the day when you're in infusion, usually at all. You can bring snacks. We also have snacks. We try to do more healthy options. So if you're going to want like a Coke or Dr. Pepper, we don't carry that. Our dietitian is who helps us decide the smart choices, and we follow those rules, but you can bring your own. And we also have Healing Place, churches, oncology ministry that comes several days a week, and they bring healthy snacks as well. So we have lots of options. The things that we do avoid are things such as anything that has an odor to it, like onions or, that would permeate, because it is an open air infusion center. It's just that each bay does have some walls, but it could affect other patients.
After infusion treatments, are your patients usually capable to drive? Are they alert?
It really depends on the regimen, which we would talk to you about that before making any decisions to drive home. But for the most part, yes, we do ask the first time that you have a support person drive you. And then if you do have a transportation issue, we have our social workers and us, we are able to help assist with rides if needed.
For someone listening who is packing their bag for the very first infusion, what would you want them to know as they head into that day?
Definitely before you come, dress comfortably. Just keeping in mind that if you have a Mediport that we have to access for your IV, you want to make sure that you have a button-down shirt or a shirt with a V in it. They do have Mediport shirts that there's buttons that you can open on whatever side that your port is on, as well as the same thing for if you have an IV that goes in your arm. You want to make sure you have a shirt that you can pull the sleeve up, or even obtain one of the IV shirts that has Velcro or snaps, and you just are able to access that arm. And so besides dressing appropriately, if you want to bring the blanket, the pillow, phone cords, and earbuds are like the biggest things people definitely want to bring with them. If you have certain drugs, we will tell you that peripheral neuropathy is a potential side effect. So we would recommend that you bring cool packs for your hands and your feet, as well as making sure that if you are doing the cold cap to help prevent hair loss, we would recommend that you make sure that you do have your cold cap, as well as there's 2 different systems that we use. And so each system has the supplies needed that you make sure that you would bring. And that's probably a conversation that we could have.
And for maybe patients that don't know, what is peripheral neuropathy?
Peripheral neuropathy is when you have numbness or tingling of your fingers and toes. So the theory behind the cool packs is that it goes to your hands and your feet generally. So if you put cold packs on your hands and your feet, the chemo doesn't get to those areas, and then you have decreased side effects. But there's only certain drugs that do that, so it's not like everybody needs to go out and buy the gel caps or gel packs for their hands and their feet. The other thing I would recommend patients, as well as their support person, but a notebook and pen to write specific instructions down. We do give patients after visit summaries that do tell them what they got, and they have written information. We give them what's called a My Journey binder that's specific to breast or GYN cancer. That's a binder where they can keep all of the information that they've been given about chemotherapy, side effect management, their diagnosis, etc., in that binder. So they have that for reference.
What about a voice recorder?
They can do voice recording. Now, I know as far as video recording, they should have permission from the provider or the practitioner. So generally, if they want to voice record, that's okay. But pretty much, I would avoid the video recording.
Thank you so much, Ashley, for walking us through the essentials, what to pack for chemotherapy and infusion appointments, and what you do and the process of Oncology Nurse Navigators. These tips can make a tremendous difference in comfort during the treatment days. Thank you for tuning in to this episode of Unprivate Parts. We hope you found the information useful and hope that you'll join us for the next episode, where we'll explore the changes to your body during treatment.
Thanks for joining us for this episode of Unprivate Parts. Don't forget to subscribe to our podcast so you never miss an episode. For more women's health tips and cancer-related content, follow Women's Hospital on Facebook and Instagram. If something you heard resonated with you, please share it with others. Thank you for listening.